Okay. All right, good afternoon. Sorry for the delay in getting started. Welcome to Legislative Post-Audit. I want to remind everyone that we are live streamed today. Be sure and turn on and use your microphones. And thank you for the lunch that was organized by Senator Tyson from Kansas Grain and Feed Association, Kansas Agribusiness Retailers Association, and Renew Kansas Biofuels Association. So we definitely appreciate the nourishment. All right, so with that, we're going to go to our first item on our agenda, the healthcare provider tax, and Heidi is going to present the audit. Welcome, Heidi.
Good afternoon. I am here to present the healthcare provider tax audit. I think that is the only performance audit you have sitting in front of you. So the team for this audit was Tanner Rohr and Macy Smith, and Chris Clark was the audit manager. The audit has two questions that are on page 1. So first of all, what Medicaid services are generating the bulk of payment distributions to non-hospital providers? And what are the add-on percentages for those services? And then does KDHE adequately monitor and report HCAP expenditures and revenues? So for the very short answer to those questions, a small percentage of the procedures are generating a large percentage of the Medicaid payments. And then the complexities of Medicaid have made it difficult for KDHE to adequately monitor the HCAP program. So I'm going to give just a little bit of background before I give you kind of the longer answer to those two questions. So first of all, KDHE contracts with 3 managed care organizations to administer the state's Medicaid program, which is KanCare. KDHE pays the MCOs a set amount for each Medicaid beneficiary each month. This is called a capitated payment. And then the MCOs pay providers directly for each service that they provide based on a set reimbursement rate. So the legislature created the Healthcare Access Improvement Program, also called HCAP, in 2004 to increase the number of providers who participate in Medicaid by increasing the reimbursement rates for those providers. So under state law, HCAP requires most Kansas hospitals to pay an annual tax based on their operating revenue. So currently, hospitals pay 1.83% of their inpatient net revenue that it earned in 2010. The 2020 legislature changed that tax from the 1.83 of net inpatient revenue to 3% of net inpatient and outpatient revenue. It's also based the tax on the fiscal year 3 years before the tax year. However, this increase has not yet gone into effect, and so hospitals are still paying that lower 1.83% rate. So KDHE combines the hospital tax revenues with federal matching funds to increase reimbursement rates to healthcare providers. So providers' total reimbursement rate includes a standard rate and then also a rate increase called an add-on percentage. So for example, if the standard reimbursement rate for a service is $100 and the add-on percentage is 30%, then the provider will be paid $130 for providing that service. So HCAP revenues are meant to pay for that add-on. So question 1 starts on page 3. Healthcare providers use a procedure code to report what service they provide. So the state's MCOs reimburse the provider the set amount for that code. So we reviewed non-hospital provider Medicaid data from 2019 that was provided to us by KDHE. And non-hospital providers are people like doctors and surgeons. So this data shows how much the MCOs reimburse non-hospital providers by each code. We only evaluated 2019, though, because KDHE was still processing 2020 claims, as well as 2020 may be an atypical year due to COVID. So in 2019, the Medicaid program paid a total of a little more than $159 million across almost 900 procedure codes to those non-hospital providers. The top 20 codes accounted for 74% of the total payments. So on page 4, that figure shows those top 20 codes and then their total disbursements in 2019. Then we looked at the add-on percentages for those 20 codes. So the add-on percentages varied significantly across those codes. So the add-on percentage for delivering a baby was just a little over 4%, but the add-on for an office visit to an ophthalmologist was almost 111%. So the figure on page 6 shows, again, the same 20 codes and then the add-on percentages for each one. So KDHE officials told us, though, that the add-on percentages were set in 2006 by actuaries, and they have not been changed since. Additionally, some of the procedures have higher add-on percentages because KDHE wanted to encourage some services. So for example, a regular doctor's office visit has a higher add-on percentage in order to encourage more preventative services. Question 2 begins on page 7. So we evaluated how KDHE monitors HCAP compliance with state law and whether the agency accurately reports on the program's finances. The state statute requires a couple of things. So HCAP revenues must be dispersed in a specific way, and then second, the program must be state general fund neutral. So state statute requires hospital assessment revenues to be dispersed in a very specific proportion. So assessment revenues include the tax collected from the hospitals and the associated federal funds. And those funds are combined, and they're paid out to providers through that add-on percentage that we just talked about. So the law requires that not less than 80% of those revenues be dispersed to hospital providers, not more than 20% to non-hospital providers, and not more than 3.2% to higher education programs. So the other state law that we looked at explicitly requires HCAP to be state general fund neutral, but it has not yet gone into effect. So state law only requires this change to go into effect when CMS approves certain changes to the HCAP program. KDHE officials told us that CMS has rejected those changes because it violated the state's CanCare waiver. So right now, the legislative intent is for HCAP to be SGF neutral, but it is not yet statutorily required. So when we looked at how KDHE monitored for compliance with these statutory requirements, we found that CanCare has reduced KDHE's ability to precisely track HCAP expenditures. HCAP was first implemented, most Medicaid beneficiaries were fee-for-service. Medicaid directly paid providers for the services they provided, and KDHE staff told us that it was easier to track HCAP reimbursements under a fee-for-service model. However, under CanCare, tracking expenditures is based on estimates of what portion of the MCO payments are attributable to HCAP. This process is also only backward-looking, and it does not allow for a real-time look at the disbursement split or how much the program is spending. So as a result, the department only knows if the program is complying with state law after the fact. So we look to see if the program complied with state law. So in 2020, we found that HCAP did not comply with those two provisions in state law. And those two provisions, again, were the provision that requires the money to be dispersed in a specific way, and then SGF neutrality. So based on our estimates using data provided by KDHE, the program did not meet the statutory distribution split. So when we calculated how HCAP assessment revenues were distributed, non-hospital providers received more than the statutory maximum. So non-hospital providers received 32% of the revenues. And this exceeds the statutory requirement of not more than 20%. When we calculated the distribution based on total HCAP expenditures, hospitals and non-hospitals received amounts that were not aligned with statute. 74% of the expenditures went to hospitals and 26% went to non-hospitals. Both of these percentages violate state law because hospitals received less than the required amount and non-hospitals received more than the required amount. So for the second provision in state law, although legislative intent is for HCAP to be state general fund neutral, we found that HCAP still spends state general funds. We found in 2020 that HCAP spent about $12 million in SGF. So KDHE officials, when we talked to them, they were aware that the program did not comply with state law in either of these areas. However, it is unlikely that KDHE can ensure compliance without changes to the HCAP program. So first, to comply with the statutorily required disbursement splits, Rates likely need to be adjusted and then reviewed on a regular basis. So we estimated that HCAP disbursements to non-hospitals might need to be reduced by as much as 30% to achieve the required distribution. Then the rates need to be reviewed periodically to ensure that the program maintains the statutorily required split over time. Second, to become state general fund neutral, the program must increase its revenues or decrease its expenditures. Currently, the state has been unable to take either of those actions. The legislature amended statute to increase the hospital tax revenues back in 2020, but that change has not yet taken effect. Further, KDHE has not attempted to reduce HCAP expenditures by reducing reimbursement rates. I should note here, though, that KDHE is not able to take a lot of these actions independently. Many of them will require CMS approval. Others will require that the KDHE work with the HCAP panel, and that both KDHE and the HCAP panel will likely need to work with hospitals and MCOs to understand what the effect would be of a change in reimbursement rates. Finally, the HCAP fund report that we reviewed does not capture all HCAP assessment revenues and expenditures. So these reports showed only revenues from the hospital tax and the related estimated expenditures. It did not reflect total HCAP assessment revenues, which would include both the hospital tax revenues and the federal matching funds. So further, they did not capture expenditures related to the federal funds. So the HCAP fund report only provides a partial picture of the program's financial position. We did make a couple of recommendations. They're on page 10. One, to the legislature to consider whether the statutory split in HCAP disbursements is feasible. The other to KDHE and the HCAP panel to review and adjust Medicaid reimbursement rates every few years with the goal of maintaining any statutorily required distribution split. So that concludes my presentation. I'd be happy to answer any questions.
Thank you, Heidi. Committee, what questions do you have? As you're pondering your questions, I did fail to introduce and to thank Representative Hubert for stepping in for Representative Barker today, so thank you. Yes, Senator Thompson.
Thank you, Madam Chair. With regard to this split, I mean, any time you make an arbitrary, certain percentage to hospitals, certain to non-providers, would you, just in looking over the data and researching this, have any recommendations of a change of the split? And would you also say that making a change in that sort of split would nudge patients one way or another into, say, non-hospital setting more frequently than the hospital setting? I'm just curious as to thoughts on the findings.
In terms of the split, it's kind of a policy decision, and I really won't weigh in on whether 80-20 is the precise right number or not. I suspect the HCAP panel and maybe KDHE has some input or some insight into what about the 80-20 was necessary or important, or if it was just kind of chosen for other reasons. In terms of whether it might direct patients, probably not. I think patients probably don't know about the split, and so they receive whatever services they need or their doctor suggests that they have, and so I think it's unlikely that it would affect people at the patient level.
I follow up just, maybe more of the physicians or the hospitals that are aware of the split. I'm just wondering, how they might redirect patients to different services to accommodate the difference in compensation.
I don't know that I could really say. We didn't talk to any doctors during this audit to assess the degree to which this program affects what they do or don't do. So I think that would probably be a question for someone who is more in the field with this. So I don't think I really have an answer for that.
Okay, thank you.
Senator Tyson.
Thank you, Madam Chair. Thank you for the report. I would ask, you stated a couple of times that the statute has not been implemented, especially the one that passed in 2020. Is there a reason for that?
The state statute directly ties the implementation of a couple of things in statute to CMS approving some changes to HCAP. So long as CMS does not approve the changes, then the statute hasn't really gone into effect because the two things are tied. I know that CMS right now has not approved the changes. They were sent to CMS. CMS denied them. Had to do with budget neutrality from our CAN-CARE waiver. I believe KDHE is still working with CMS, though, to try to understand what they need to do and are still trying to get something passed through CMS. So once CMS does make those, does offer that approval, then those couple of provisions in state law would then go into effect.
Committee, I do have one question. So as we're looking, it's very concerning that we're $30 million above what we should be to be revenue neutral, $12 million in state general fund. And on page 9, one of the remedies was that we need to reduce as much as 30% of our non-hospital reimbursements. So in your calculations, that would be approximately 30 million, or would that approximately be 12 million? And were there anything in your estimation or in your review that would indicate that the hospitals also should be looking at reductions?
The 30% reduction is really is in conjunction with getting the disbursement split correct. So to get the disbursement split, that correct 80-20 that's in statute, we estimated that they need to reduce the non-hospital side by 30%. So that would help them get in alignment there. For the SGF neutrality issue, there's kind of two issues there. We kind of highlighted both. One is, to get in compliance with that, either the expenditures have to come down or the revenues have to go up, because basically the program is overspending its SGF. It should be zero, it's at 12 million. And so until the program can make one or a little bit of both of those changes, it's unlikely to be neutral, and they are likely to continue to spend some amount of SGF. And so we talked about those two options, and so far the state hasn't been able to take either one of those options, which is why the program is continuing to overspend.
Looks like our HCAP needs a cap. So, all right, any other questions from the committee for Heidi? All right, thank you, Heidi. And I know that this audit will be passed on to the health committees, those chairs, to review and to consider what could be done. All right, I would like to recognize Randy Kaysen. He's the commissioner of the Healthcare Access Improvement Panel, and he is with us on WebEx.
And can the committee hear me?
Yes.
Good, thank you very much. And I just wanted to make sure that I made myself available in case there were any questions on behalf of the HCAP panel. Again, thank you for the opportunity to speak to on the program audit, and on behalf of both the Healthcare Access Improvement Panel and Kansas Hospitals. Again, my name is Randy Kaysen, and I am currently the chair for the panel. I am actually also the regional vice president for University of Kansas Health System, but I do serve as chair for the panel. And I guess what I'll do is just skip down in my testimony that I did have submitted to the committee. I'll just kind of skip down to some of the questions I heard, and I'll just kind of focus on that part of my testimony. Once it was determined that there was overspending in the program, similar to what this audit has found, the legislature directed the provider to develop a self-sustaining program to rebalance the expenditures. After 2 years of work, a new program design was created and presented to CMS in the fall of 2019. The new program would continue to pay physicians a rate enhancement and maintain the funding of graduate medical education. But it would change the enhancements to hospitals to a quarterly payment from a fixed amount of dollars based on claims paid by Medicaid for that quarter. The new program includes an increase in the assessment rate from 1.83% that you heard earlier of net inpatient revenue for 2010 to between the current amount and 3% of net inpatient and outpatient revenues based on revenue from the third prior year. What we do find ourselves in right now is we're in this frustrating position of waiting for CMS to approve our new program. One of the stumbling blocks to implementation has been the Care waiver, because the waiver has a budget neutrality cap, and the new waiver was implemented on January 1 of 2019. Any new expenditures to the program after that date must fall within the cap, according to CMS. Unfortunately, the anticipated 3% increase in the assessment would make expenditures for the program exceed the cap. Our response was to request flexibility in the statute to allow an increase of less than 3% for the waiver, which the 2020 legislature passed, an action that Kansas hospitals do appreciate. My final comments. While we continue to work with our congressional delegation, the governor's office, and KDHE, we are still awaiting the program change approval. Progress has been made in this area with the approval of the technical correction to the waiver, which made another $394 million available over the waiver's life, which was recently approved. We continue to work with KDHE and the governor's office to identify what amendments will need to be made to the existing program request to utilize those additional dollars. We appreciate the work of the Division of Post Audit and their recommendations, and the continued assistance of the legislature to address the needed changes to the program. I would make myself available to questions, and also I believe Audrey Dunkel with the Kansas Hospital Association is present. So if the committee has any questions that we might be able to answer.
Chairman Kaysen, we do have also with us KDHE on WebEx, and they can answer questions as well. Committee, do you have any questions for Chairman Kaysen or for KDHE? Yes, Senator Thompson.
Thank you, Madam Chair. I'm just curious, who sets these add-on rates and the compensation levels of the add-on rates?
Heidi, would you like to answer that?
Add-on rates were set in 2006 by actuaries,
Okay.
and they have not been adjusted since. So they've been in place for quite a while with no adjustments.
Would that be something that we would want to look at? How frequently those are adjusted depending on the types of services, because it seems to me like if we're giving higher add-on rates for some services that are not as critical as other services, we might be spending more money than necessary and be able to cover more patients by adjusting those weightings.
We recommended to KDHE and HCAP. They both agreed with the recommendation, although they had some concerns about getting it implemented. But our recommendation to them was that they should review those rates and those add-ons on a regular basis. So the last time it was reviewed was 2006. So it's been quite a while. And so we suggested to them that there should be a regular review. We didn't tell them how many years it should be. We said every few years. So we would leave it to KDHE and HCAP to decide what, the exact number of years that would be appropriate. But we do think it's a good idea that they begin to look at that and make adjustments on a set schedule.
Right, good recommendation. Any other comments, questions? All right, we will close the section. Thank you, everyone, for providing some information on the healthcare provider tax. The next item on our agenda is the audit proposal selection, and Chris is going to walk us through that with first an overview, and then we'll come back to individual audits.
Yes, ma'am. Thank you, Madam Chair. First, I'm going to go over this sheet, which should be on your desk. This is just sort of a very high-level overview for 2021. This is on a calendar year basis. It's showing all of the audits that we have completed or are in process or are upcoming, both performance audits, IT security audits, IT monitoring reports, and economic development tax incentives, both of which are statutory. And then the chair wanted to know kind of what was coming down the line as far as statutory requirements. So that's what the 2022 and 2023 columns are. They're showing things that are currently in state law that are requiring us to do performance audits in those areas. So that's the big picture of what's going on. Today, we're going to focus on filling out 2021, which is kind of the area in red. So we have a number of topics to go through. We have about 15 proposals. Normally, we would ask you to pick about 5 or 6 to fill out the rest of our year and into the beginning of 2022. However, as you can see in the red, there is a statutory required audit yet to be completed this year. So that is one of the topics you must pick, which is 1L on our list, which I will go through in a minute. There is also a Senate substitute for House Bill 2313, which is currently still alive and in the works. And that would have us do an economic impact study of public entities and governments competing with for-profit businesses. So that, if that goes through, we'll have to do that one as well. So that's limiting the number that you can select from for the remaining proposals. So I would say I'm going to go through the list. I would say instead of 5 or 6, probably about 4 would get us where we need to be for the rest of this year. Did you have a question?
No, proceed.
Okay, I'm going to go through a summary of each one. And Madam Chair, we have a few legislators here in the audience who would like to speak on their topics. I think I'll go through the summary, take any questions, and then maybe if it would be appropriate for you to recognize them at that point. Okay, so now we're in tab A in your booklets. There's a cover sheet that has a summary of each topic. It's about 5 pages long. And then the full proposals for each topic are attached after that. So moving right along, request 1S, which is the statutory one that I mentioned. It is required that we do this in 2021, so you must approve this topic or some version thereof. This is KSA 77-416, which requires us to study the accuracy of economic impact statements, the review by the Division of Budget on the accuracy of those statements, and whether a statutory threshold is appropriate. And this has to do when agencies adopt rules and regs. So the proposal has 3 questions. Does it appear economic impact statements submitted by state agencies are generally accurate? What impact has the review by the Director of Budget had on the accuracy of those? And is $3 million the appropriate amount of economic impact to trigger the hearing procedure? Madam Chair, I'm just going to go through them all, I think, and then if you have questions. Okay. Proposal number 2E. This is a carryover from last year. It might look a little familiar. Last year, you all approved an audit of the state fair. You had made some modifications. We didn't get to it, and so the committee decided to bump it to put back on the proposal list for consideration this year. This actually has 2 questions. Hopefully you have the right copy in front of you. This is, does the state fair have adequate controls to ensure accurate accounting and prudent use of resources? And second, how does Kansas compare to other states in terms of the state fair funding, expenditures, and promotion efforts? Topic 3L is a legislative request. This is a resubmission by Representative Sidney Carlin and Senator Tom Hawk looking at the State Employee Health Plan Pharmacy Benefit Manager. The concern here is that Pharmacy Benefit Manager concerns over their reimbursement rates and that the state lacks sufficient oversight to ensure it is getting the best value for prescription drugs through the state health plan. This audit has 4 questions. Does the state have sufficient controls in place to monitor and oversee the pharmacy benefit manager? Do the terms, Caremark is our current pharmacy benefit manager, do the Caremark terms in its contracts with pharmacies related to price comparisons and pricing information comply with state and federal law? Have reimbursement rates changed significantly over time, and if so, why? And what steps do other states take to help control pharmacy costs in their employee health plans? Topic number 4 is a request by Representative Finney on the impact of suspended and revoked driver's licenses. Legislators have expressed concerns regarding the impact of those driving restrictions, including how much it costs and how much time it takes to reinstate driving privileges, and the impact on citizens' abilities to get to work or school. The audit has 2 questions. What's the economic impact of Kansas's process for suspended and revoked licenses on Kansas drivers? And how does Kansas driver's license suspension and revocation process compare to other states? Topic 5L is a request by Representative Christy Williams and Senator Karen Tyson. This has to do with evaluating the implementation of performance-based budgeting process. In 2016, state law required Kansas performance-based budgeting system to be implemented in 3 phases. Concerns are that agencies have not done this adequately. So this is 2 questions. Was Kansas performance-based budgeting system adequately implemented as outlined in state law? And are state agencies providing accurate and reliable information for the required budget system? Proposal 6 is COVID relief funding distribution, requested by Representative Christy Williams and Senator Karen Tyson. Legislators had questions regarding distribution of CARES Act and of other COVID relief funding. The questions about the governor's SPARK task force relate to how decisions are made, what criteria are used, and how Kansas's distribution process compares with other states. There are 3 questions. What is Kansas process? Have the distributions been appropriate, and how does Kansas compare to other states? Request number 7 regarding foster care services for the health and safety of children was requested by Representative Owsley and Representative Kincannon. Legislators have expressed concerns about whether foster care contractors and child placing agencies are providing appropriate services to help protect the health and safety of children in foster care. So the questions are foster care case management contractors and child placing agencies following adequate policies and procedures to ensure the safety of children? And do foster care case management contractors have sufficient capacity to provide necessary services? Request 8 is evaluating efficiencies in the Child Support Services Program. This was requested by Chairman Williams. There are concerns that child support collection system is inefficient. Questions about what can be done to increase the number of child support payments collected and distributed. There's 2 questions in this proposal. How much has it cost the state to enforce child support orders during the past 10 years? And what can Kansas do to collect more child support dollars for children in our state? Proposal 9L is evaluating the effect of remote learning on student outcomes, requested by Chair Williams. There are concerns here that remote learning has an adverse impact on student outcomes, both in terms of state assessments, dropout rates, failing grades, and the effects on ESL students or special ed students. The proposal has 2 questions. How many school districts used remote learning for 4 weeks or more during the 2021 school year? And what were the effects of those learning on student outcomes in that same year? Proposal 10L, reviewing costs associated with post-secondary developmental education. That is another term for remedial education. This was requested by Representative Williams. Concerns here are about the costs associated with post-secondary institutions providing remedial courses for recent Kansas high school graduates. Question is whether the costs associated with Kansas colleges and universities providing developmental courses in recent years. Proposal 11, reviewing issues related to concurrently enrolled high school students. This is requested by Senator Renee Erickson. Legislators have expressed concerns that the state may pay for a concurrently enrolled student's education twice, a payment to the high school and a payment to the college. Further, they're concerned that post-secondary institutions may not be paid properly for the courses they do provide. So 2 questions here. Does the state's policy to pay post-secondary tuition for concurrent courses result in the state paying for something twice? And are post-secondary institutions being paid properly for the courses they do provide? Proposal 12, this is a staff proposal. Recent LPA IT security audits have raised questions about whether IT security services provided through Audit and KSO are sufficiently available, comprehensive, high quality, and cost-effective. There are 2 questions in this audit. Are the IT security services offered through these agencies comprehensive to meet statutory requirements and state agency needs? And do these offices provide high quality and cost-effective services to state agencies? Proposal 13 is also a staff topic. This is about IT security practices across Kansas school districts. Again, our IT security team has noticed that several districts have raised concerns about the staffing and resources districts use for IT security. So this would look at whether school districts are following appropriate IT security standards and whether districts devote adequate resources to IT security. Proposal 14, committee rules say that we present you a follow-up proposal each year. So this is our proposal to review agencies' implementation of selected performance audit recommendations. The agencies this proposal would review are juvenile justice. We would follow up on whether they ever implemented the data sharing agreement and are they using grant monies appropriately. For Audit, we would follow up on the rate setting process. These all come from prior audits. And for our surplus property, we would follow up on whether they've sold the properties we recommended and whether they've established criteria to ID surplus properties appropriately. And finally, last but not least, Proposal 15, again, is a staff topic. We came across an Arizona audit in 2020, so pretty recent, that showed deficiencies in its State Board of Pharmacy's work. Those deficiencies included that it didn't ensure compliance with state licensure requirements, it didn't always fully investigate complaints, and it did not meet inspection timeframes. So this audit would be doing something similar for the Kansas State Board of Pharmacy. There are 3 questions. Is the Board of Pharmacy ensuring all state license and registration requirements are met? Are they fully investigating all complaints? And a 3rd question about how does the Board of Pharmacy ensure that vaccinations, such as the COVID vaccine, are safely administered by pharmacists? So that's a summary. If anyone has any questions, I'll be happy to answer them. The full proposals are attached for each one. And again, there are Representative Finney and Representative Ousley are here.
Yes, we're going to take testimonies next before we go into questions for you, but I do have a brief question and it will be helpful to the committee. When we look at these 15 audit proposals, I would note that generally that number is much higher. Would it be around 30 or so on a given year? Okay, so it is a lot smaller. I'm not sure why it was this year, probably because it was an abnormal year. And then my second question is for everyone to understand what happens to those that are not selected. Do they stay in a queue because it's a biennial, or do they expire in 2022? And we also do understand that if time permits, as the year continues, there may be room for an additional audit depending on the size and scope.
Correct. As far as the topics that are not selected today, if they are legislator requests, they fall off, but I reach out to those legislators to see if they would like to resubmit. One of the proposals, number 3, happened, it fell off last year, but Representative Carlin and Senator Hawk wanted to resubmit, so it just reappears the next year. Staff topics pretty much fall off unless you express interest. I think that covers it. And then throughout the year, if a new proposal, if a new legislator or a legislator presents us a new proposal, we bring that to the committee sort of ad hoc throughout the year.
Okay, great. And we will have discussion on these items as motions come or arise. But let's first start with testimony from our representatives that are with us so that they can either stay or leave as convenient. Representative Finney, she has the first item on our list. So this would be, let's see, 4L. Welcome.
Well, thank you. Thank you for this opportunity, Chairman Williams and committee. My audit proposal is in reference to suspended driver's licenses. I've been in the legislature since 2009, and since 2009, I've introduced different pieces of legislation regarding suspended driver's licenses. And in 2011, I was successful at getting the restrictive driver's license. And since then, myself, Senator Fausto, and several other legislators, and including the Kansas Criminal Justice Reform Commission, we have all been introducing legislation on this because I believe, and several other people believe, that this is definitely a negative impact on our citizens. In this particular proposal, there's two different objectives. The first one is what is the economic impact of Kansas process for suspended and revoked licenses on Kansas drivers and the state. I would think that if we were to really delve into this and to collectively work on it, we would find that in addition to Kansas being rated nationally number 5 as out of the top 10 states, Kansas is number 5 with the highest suspended driver's licenses. And this amount that you have here on the paper, it says 127. I do believe that is the number of unpaid tickets because it has been ranging over 200,000 people in Kansas that has suspended driver's licenses. A lot of them, I believe, are from failure to pay. One thing I want to make sure I leave with you is not only is it the citizens that have to get to and from work that this impacts, but it also impacts some of us who do not have a suspended driver's license. When you have this many people driving around, mostly if they do not have a suspended driver's license, they probably don't have insurance. So it does indirectly impact a lot of us. And also, one of the things I want to keep in mind is that it has been estimated that in Kansas, like 71% of those people that do have suspended driver's licenses are continuing to drive because they have an option: do I drive and I lose everything, or I don't drive and at least I can continue to work? So that is the issue that they're dealing with. But also, Kansas has a problem with an excess number of prisoners in our facilities, and on reentry and recidivism, one of the major problems is approximately 56% of those people, this is a quote directly from the Department of Corrections, is the people that get out, getting a driver's license has been just really hard on them. So they've been trying to do things internally, but that has been a problem that sends people back to prison because they can't drive. And there's other restrictions too. It's hard for housing, but they say getting a driver's license has been the #1 issue with our recidivism rate because people cannot find work or get out there to and from work because of transportation. So this is why I'm submitting this proposal. One of the things I'd like to add, in February of last year, the Criminal Justice Reform Commission, we had introduced House Bill 2547, and most of that bill went into effect this year in Senate Bill 127. But there were still some issues that didn't get put in there, like the $100, what we call a reinstatement fee. We were trying to get that reinstatement fee from per item to a group of items. Say, for instance, if you got arrested or pulled over and got your driver's license suspended and you had 3 tickets, the reinstatement fee is like $100 per reinstatement, and we were trying to get it to be like $100 per incident. And so that didn't get implemented. And then another issue that we have found that was really severe to our state is the failing to appear. Because in Kansas, if you fail to appear for court, you automatically lose your your license are automatically suspended. But one thing a lot of people don't know is that those licenses, when you get pulled over, and if your address is like mine, 1754 North Madison, but if I've moved 3 years ago and I didn't update my driver's license, that is where they send the ticket to. So a lot of people, they really don't realize that it is really important. If you don't update your driver's license, you will end up getting a warrant in the mail. And if you don't update that, you'll be surprised when you get pulled over for a minor traffic violation. You could be pulled over and arrested because you had a warrant that you were unaware of, and it resulted from us not being technologically advanced on like emails or updating people's address. So I really think this is a big economic impact with us because people are unable. Oh, is that my time is up or something? Oh, I'm rushing it. So I think that we really need to look at this as a whole because I really think that a lot of this problem could narrow down to under $1 million that we could fix this. One of the problems always come back. As I mentioned before, in February, I held a meeting with all the stakeholders, the law enforcement and OJA, Office of Judicial Administration, and different people, and we came up with, these are the things that we want to do. We realized that we were $750,000 difference from actually implementing major change in Kansas. And I had talked to the governor's staff about it, and they said they would find money, but the biggest objection has been the OJA. And I just think if we can work together on this, like, as a whole, I think we'll be able to refine our process in Kansas. And then the last objective is just to compare what other states have done to repair this issue with suspended driver's licenses. So if there's any questions that you may have, I'll be happy to answer them. But I would hope that you would consider this proposal on behalf of all Kansans. Thank you.
Thank you, Representative. Are there any questions for Representative Finney? And you're welcome to stay as we discuss this and the other audit proposals.
Okay, thank you very much.
Thank you very much for your testimony. Next, we will have Representative Concanon, and she is here to talk about 7L, which is the foster care audit. Welcome.
Thank you, Madam Chair, members of the committee. First off, I want to say thanks to Chris for helping us with the questions that we are requesting for our audit. So I've got some written testimony that is being passed out. I just want to add a couple of quick points on that. Last fall, we had an interim committee that did foster care oversight, and there a news article came out that had my name in it as the chair of that committee. And after my name was out there in the state, I started getting phone calls. And I know Representative Owsley gets the same. I filled a legal pad of notes from these phone calls that I'm getting. And foster care is an emotional issue. You know that you're going to have some complaints. But it was alarming at the number of complaints and the level that were being charged. People just feel like they're not being heard. So that's kind of was my impetus for getting involved with this. And then, so this notebook is these are the audits that have been done in foster care for the last 10 years. I went through them, and unfortunately, audits happen, deficiencies are found and reported, and then nothing's ever done. So I just want to say the timing on this is great for us because we are about to pass a bill that establishes a foster care oversight committee, and the opportunities that we would have for follow through on this just would be a great advantage, and I don't think that an audit would be stuck away in a notebook on a shelf. So that I'll thank you all for your consideration.
Thank you, Representative Concanon. Any questions for Representative? Senator Olson has a question for you.
Thank you, Madam.
And I will note we do have Representative Owsley that will speak to this issue as well.
Sure. Thank you. Thank you, Madam Chair. Just one question. Have you ever, I always see these audits on the foster care and they go to the contractors in the state. There's one piece that's always missing to me on the audits that we need to review. The judges that are reviewing these cases, I don't know if you've thought about expanding your audit, take a look at all the judges across the state, where these kids are missing, where the problems are. Maybe we need to take another step a little higher and look at some of their work too, because that could be where some of the problems are. Have you thought about that, or?
Absolutely. Yeah, that was, there are issues on every level. I mean, we've gone from being a highly respected foster care system to not so much. But it's the judges, it's the guardian ad litems, the whole judicial system. I don't know, this is kind of the direction we went with this to get started. I don't know what authority we have with judges. We did talk about it during the Oversight Committee last fall, and talked about having some training for the judges, because we're hearing horror stories from both directions. But I appreciate your comments. It just didn't land in the scope of what we were talking.
Just a follow-up comment. I've been here 17 years, and this has been a mess from day one. I've sat on a lot of meetings. And, it's just heartbreaking, the cases you hear. And this is not a Republican or Democrat issue. This is a Kansas problem. And I really wish we could fix this, but, yeah, thank you.
I'm pretty determined, sir.
All right. Any other questions? We'll go on to thank you, Representative Kincannon. We have Representative Owsley. Welcome.
Thank you, Madam Chair, and thank you, committee. And thank you, Senator, for your comments. I couldn't agree more. And I do think we do need to take another step, and I hope that we can continue as a legislative body to work towards an Office of the Child Advocate that we can all agree upon and get these kids some help. But I agree with my chair of Children and Seniors that this would be a good step towards recent information gathered for the Oversight Committee to start diving into and really getting to work and starting to solve some of these issues and not just, spin the broken record. So I appreciate the committee's consideration and time, and I'd answer any questions if anybody had any.
Are there any questions, committee, for Representative Owsley? All right, no questions. Thank you. All right, committee. So we have the 15 proposals that are in front of us. And what we're going to do is we are going to take motions for proposals, and then we're going to have discussions. I want you to be able to really work through your thoughts on it. Don't think that your motion will be the last comment that you make on it, but we need 4, is that correct? 4 items. Please also remember there are lots of other resources available, including legislative research, including our revisers, including advisory councils and commissions, that if it is not perhaps selected today, it's not the end of the road for the item. It even has a second shot later this year, as well as next year. So with that, I will open up the floor. Yes. Yes. Yes, question, Representative Tyson, then Representative Olson.
Thank you. Just on procedure, can they be amended then, the request, based off of Senator Olson's comment?
Okay, I'm going to ask Justin to expand on that.
Thank you, Madam Chair. Yes, the committee rules are very clear that the committee has jurisdiction to modify any of the requests that come before it. What I would request you probably do is to approve it conceptually. That way we have the action done, and then we as staff will go find a way to make sure we communicate the results back to the committee in case you think we've missed the mark. But yes, the rules make very clear this committee has ultimate authority over all requests and can adjust any part that it sees fit.
Perfect, thank you. Senator Olson.
Thank you, Madam Chair. I want to go ahead and make a motion to do 7L, and that's the foster care service one. I don't know, I would like to add judges in and see if we can't, narrow it down, which judges are, the problem cases are, say, the ones that have missing kids, how many missing kids, and,
All right, we do have a motion on the floor. It's conceptual with addition of expanding the scope with some form of look at judges. And so we'll ask legislative post-audit to kind of put together how that would be included and how that changes the scope of the project and the time frame. And it is seconded by Representative Gardner. Now, further discussion. Representative Burrows.
Thank you, Madam Chair. A couple of questions, if I may. I was advised by Representative Carlin that she would like to pull 3L, so we can drop that if anyone was considering that. She advised me before we came, so I thought the committee should know that. And I do have a question for staff, if I may, on the recommendations on 12E and 14E. Is there any chance that either one of those audits could be a 100-hour audit, or, Madam Chair, I can't remember about a 200-hour audit request?
So yes, I think that I've thought that as well, that there are many on here that if they were divided apart, that they could be smaller audits. If I would ask, put that on hold, let's finish the foster care, we'll come back to you.
Thank you, Madam Chair.
All right. And there's a motion on the floor for foster care. Any further discussion? Representative Gardner.
Thank you, Madam Chair. Just a follow-up from the senator to my left. I hope we can maybe focus on this judge situation narrowly, maybe working with Representative Cannon, Representative Owsley, to let's really focus. Is it training? What judges need help? Identification? That would, I think, would be appropriate.
Senator Olson.
Thank you, Madam Chair. I think probably with the judges, the biggest thing I would be looking at this stage is the kids that are missing, how many, that's probably the first thing. We can always do a follow-up audit down the road or ask for a 100-hour audit to start expanding that way. But, where the kids are missing, if we've got judges that are, something's going on there where, one judge has a lot, I think we need to start to look at that. So I think that's probably where my intention is right now on the judges. But I want them to be, if there's a problem, that we need to start to look there. Thank you.
All right, good. Other comments and questions on this item? All right, all those in favor say aye. And those opposed, nay. All right, unanimously approved. So we know that this is conceptual. We know it'll be brought back to our committee. And for those that are interested in the judge portion, I'd ask that you stay in touch with Justin and Chris, and we'll review that. Now, as we're going to go back to Representative Burrows, and let's look at how many limited scope we already have. Do we have 4 this year? Is that right? We have approximately 4 this year. One was on COVID testing, death certificates, one's related to commerce, one's related to Butler Community College, and one's related to, I can't read very well, CTC something grants. Thank you. I just can't even see that. And so usually there's room for approximately 10 a year. They're limited scope 100 hours, and we approve them as they come in. And so if any of these bleed out into that, that's certainly an option for this committee. And I'm going to do Representative Burrows and then Representative Topliker, and then Senator.
Madam Chair, I would just like to get some clarification on the, I'm sorry if I had my numbers. The 12 and, I think I wrote down 12E and 14E as to the amount of time necessary that staff would have in which to look at those.
Would you like to comment on that, Justin or Chris? You referring to 12E and 14E, is that correct?
That's correct.
Okay.
So, Madam Chair, and I would also invite Chris if she has comments. Chris just pointed out to me right away on 14E, you'll notice that is already fairly reduced. It's 1 staff, 2 months. So it's not a limited scope, but it's fairly small. So those usually could be slipped in fairly easily within our schedule. We would not count that. In terms of 12E, what I would suggest to the committee, and Chris and I have talked about this before, we can turn any regular audit into a limited scope audit. The method by which we do that is we significantly focus the concern. We narrow the scope a lot. So in this type of case, when we talk about the security services they've authored and whether they have high quality services, we'd have to significantly reduce our scope of our work, which then may or may not tell you a lot about the state of the state as a whole. So I would suggest we could always do something. The question would be what we would do in order to make that a 100-hour audit. Was that actually? We could work that through with you, and sometimes we can, and sometimes.
Thank you, Justin. The reason why I ask about possibly reducing is if we went to a smaller audit, that it would then determine what depth we need to dive into this particular item. Because I know OITS in the last year has made tremendous strides, having worked on that budget for a number of years. I think this was the first year that we actually accepted it without much question because of the transparency in which they presented. But I do know the KSOs is some concern, as was OITS, but it may be that we can identify what it is within OITS the committees might have issue with. But I was just curious if that one could be reduced. I do believe that 14E is probably just a 100-hour audit.
Okay, so Representative Burrows, would that be an item 12E you would work with Chris on and see if you could come up with a limited question? We could bring that for a consent item next time in June.
That's fine, Madam Chair.
And then it looks like there may be also a request by Representative Burrows to add 14E as a consent item in June. Would that be correct?
Yes.
Or would you like to wait and talk to Chris about that later?
Well, Justin did state that we could possibly
Squeeze
move
it
that in, and I'll talk with staff, and
Okay.
if it's okay with the committee, if we can do it in a smaller audit and get it done quicker. I just hate to see some of these other audits set out here because we load up the amount of work that needs to be accomplished. If we can shorten these up a little bit to determine if we need to go further.
Right, okay, so then I would suggest, if it's okay with Representative Burrows, that we take both of those, set them aside to consider for a consent audit in June, and we take that in consideration as we look at others, making space for that more limited room. So we do have room for limited scope audits right now, and so that would be perfect if that's amenable. Okay, Representative Toplicker, and then Senator Tyson, and then Senator Ware.
Thank you, Madam Chair. Yes, I wanted to bring up 5L, which deals with performance-based budgeting. And I wanted to go ahead and propose that one to be one of our audits, mainly because of the accurate information and reliable information that we need from agencies in crafting the budget. And so, we get the budgets and we look what one person wrote or a department wrote, and we have to rely on that to make millions of dollars worth of decisions on sometimes, and I think this is extremely important. So I would move 5L.
Do we have a second? Senator Thompson is the second. We're going to have discussion on this item. Senator Tyson.
Thank you, Madam Chair. Actually, I think the scope's fine with what we've got. I know this is going to be difficult, but I do agree with the representative. I think it'll be critical to help us be more efficient and effective as legislators in watching the budget.
And to note, this is a little bit different than what was line item vetoed. That 2% is not part of this. This is more taking an overarching look at that process and how it's being implemented. Any other questions on this item? It is 5L, evaluating the implementation of the performance-based budgeting process. I didn't ask this the first time. I don't generally. Would you like to close on your motion?
Madam Chair, I close.
All right. All those in favor of 5L, say aye. Aye. And those opposed. And so it passes, and it will be on the agenda. Senator Thompson.
Thank you, Madam Chair. I would like to consider 6L, the COVID relief funding distribution, as one of the audits. We had a huge discussion on the floor yesterday and over the past couple of days in Judiciary Committee about the amount of federal funding that's coming down, and we couldn't get a clear answer on how much funding was encumbered, how much was unencumbered. We've got another big tranche of funding coming down from the ARPA coming down. It's got to be an additional, what, 1.6 billion on top of that. And my concern from the start has been, where is this money going? It would be very good to be able to see, I think, how is this being spent? What kind of decisions are being made? I think 6L is a very important one because we're going to have more of this type situation to deal with in the coming year as more of this money comes in. And so I would move that we consider 6L for one of the post audits.
Do we have a second? All right, Senator Olson is the second. Let's discussion. Senator Tyson.
Thank you, Madam Chair, and thank you. I would actually like to address the scope on this since we're flexible on it. I would like to basically remove, I don't really care what other states are doing with their funding. I would like to see more of a focus on, I received some information recently about a couple of counties that used it for pay increases and different things like that. And I think we need to understand how this money was spent, and the time would be more critical spent on that effort than what other states are doing, if the committee would be acceptable to that. Thank you.
All right, so the request has been made for it to be a conceptual amendment that we do look at even details of, are these ongoing expenses such as salary increases? So Representative Burrows and then Representative Gardner.
Thank you, Madam Chair. It's my understanding that the monies that went to the local governments, if they are misspent, the local governments will have to repay those dollars. So I guess my concern would be, why are we interested in how they spent their dollars? They're going to be held accountable by their federal audits. I mean, that's the only question I have. I too would be curious as to why they chose to do that, but they have to be in compliance with the federal guidelines. If they're not in compliance, then they will have to repay those dollars. And I don't know that we need to spend additional resources on auditing local governments, but state dollars I can understand, but the local dollars, I'm just curious as to why we would do that.
Representative Gardner.
Thank you, Madam Chair. Just to follow up with Representative Burrows, I think looking back at the Government Accountability Office, they have the responsibilities to go in and audit states on their Sparks fund or on their CARES money and how they spent it. I think that date has been now slipped back. It was, by December or February or March. I think we heard that date when we were serving on the Economic Recovery Committee, but I think that date has been slipped back somewhat. So I don't know. I'd rather maybe go into choose another audit at this point versus rehashing or spending resources trying to do something the feds are going to do anyway. Thank you.
Senator Olson.
Thank you, Madam Chair. First, I want to state I will second the conceptual amendment because, I don't want to get away from procedure. But my thinking is that, maybe there is some duplication. I don't have a problem with that because I think we need to know transparency what happened with the money. Even though we're the state government, it could have it could be more of a pass-through. I still think we need to know how cities spend it. So I don't have a problem with that piece. Every dollar's going to be spent 3 or 4 different ways. They're all, we're already fighting over every dollar here in the capital to spend it 3 or 4 different ways. So, so I don't have a problem. I like what Senator Tyson did by limiting what other states are doing, because, maybe that'll shorten the time frame of the audit. And, I've chaired this committee, been on it a long time. I just want to make sure that we don't get away from, we got some staff recommendations here on some IT audits. I think that's probably, as we know, after looking at UI, even more vulnerable the state is in so many ways. I'd hate to turn them into 100-hour audits. I'm going to be honest with you. I think the biggest risk that this state has is its IT system. And, if you were a bank, I think that's probably the first thing. I know it's the first thing because I've been on bank boards on banks that the regulators look at. I think we should not skimp on the time we do. And I think we've got staff recommendations here. We need to think about that. That's just a two-part conversation.
Great, thank you, Senator. We're back on track with the second, and I am going to come back to your comment on that, but I'm going to go to Senator Tyson.
Thank you. I would like to address the, it may not appear as it impacts the state, but if it was actually used for salaries or not bonuses, it could impact CAPER's payout, and it does, there are indirect consequences that could impact state funding and resources. So that's what raised a flag for me.
All right, Representative Burrows.
Thank you, Madam Chair. Thank you for the second bite at the apple here. Senator Tyson, I don't disagree with your statement. My comment was that these CARES dollars were given in a very short amount of time in which to be utilized and without much guidance from the federal government. I just wanted to, let's not send the message that we don't trust our local government. I think that's what I'm kind of hearing with that request, but you did explain the impact it could have on CAPERS, so I do understand. If the motion's been made and seconded, I'm a local government guy. I do hope that through our auditing process that those dollars were spent properly, but with the number of requests that went to the federal government for guidance and not getting that guidance in an accurate amount of time, who knows? But, whatever the committee chooses to do. But thank you, Madam Chair, for my second bite at the apple.
Senator Tyson.
Thank you, Madam Chair. This isn't to poke at anyone. This is just to find out where the money went. It's not, because we're looking at the state also. So I just want to make that clear. Thank you, Madam Chair.
Okay, we're going to complete the motion. Yes, Representative Gardner.
Just very quick, Madam Chair. Thank you. Maybe I understand the discussion, but maybe we ought to, just a suggestion, maybe we ought to put this off a while and go back and look not only at CARES, but the American Rescue Plan money that's coming down the pike at $1.6 billion to the state, and the Legislative Coordinating Council who will be responsible for spending that. It might be that we reevaluate, we look at where all this money is, where it's going.
Okay, I think even though it does say COVID relief funding, it does specify CARES and Spark, but because we are, I think there's a lot of flexibility to look at additional dollars, and that may be the intent of the maker. So we would probably be flexible on that. Yes, Justin.
Madam Chair, just as staff, quick technical clarification. I want to make sure I understand the substitute motion that Senator Tyson made. So it would be to kill objective 3 in favor of doing more work, really in objective 2, which is looking at the appropriateness. Yep, and looking at bonuses, salaries, some of those things. I also need to hear, I think, the approval from Senator Thompson as the first, because Senator Olson gave it as the second. So,
oh, good. Good. All right. Is that amenable to you? A substitute motion, yes, and I believe it is for Senator Olson as well.
Yes, yes, absolutely. I think that's a good idea.
Okay. Any further discussion on this item? No? All right. All those in favor of this item, say aye. And those in opposition. All All right, the motion passes, and we have our third item. Now, we do have only one more item to select, but again, want to remind everyone that there are other methods that we can use to do a smaller scope or to help you find another pathway. So we do have 3 in the queue to speak. We have Senator Ware, and then Representative
Hubert.
Yes, thank you.
I'm new here.
Hubert, I wanted to call you Barker. And then Senator Olson, I want to come back to you on your comment on the IT. So I don't want to, that's an important item, and I want you to be able to talk about that. So Representative, Senator Ware.
It's okay, I'll be in whichever chamber I need to be in. You know, I think given what we've talked about and the things we want to look at so far, a really wonderful balance would be Representative Finney's driver's license bill. It's an issue, as she said, that affects us all. But the folks that it affects the most are the folks that have the fewest resources. And I feel like that's the biggest reason for all of us to be here, is to take care of those who aren't as blessed. Frankly, that's the bottom line. And I'd like to know just what a difference the driver's licenses will make. So thank you.
Okay, we have a motion on the floor for item number 4L. Do we have a second? We do have a second on from Representative Gardner. And so now it's time for further discussion. So I will comment on this item and then open it up for other comments on this item. Thank you, Representative Finney, for bringing this item to our attention and reaching out, and others have reached out to me as well, including the Chamber of Commerce of Wichita and the Chamber of Commerce of Kansas. I will acknowledge that. I have talked to individuals that are part of the Judicial Council and those that have served on the DUI advisory board. And so one of the things, this is a topic that they have looked at and want to continue to look at, and they feel that that's in the scope of the Judiciary Council. I'm not sure if that's something that you reached out to the Judiciary Council on or not. No, not yet. So that may be a good option. Another option in addition to that, because I think that is it's something that obviously needs to be reviewed, but there are 2 items on it, and I think that one of the items, how does Kansas driver's license suspensions and revocations process compare to other states? You could do a limited scope on that. I think, Chris, could you do a limited scope on item 2 of 4L? Or is that too expansive? A sample. Okay. Sample state. So there's a couple of thoughts here for the committee, and if somebody wants to make a substitute motion, they can. I'm going to refrain from doing that. We have a motion on the floor. That's the only way that we would be able to adapt is through a substitute motion to recommend another audit, limited scope audit and we could do that. And then, of course, the recommendation would take this to the Judicial Council. Okay. Senator Olson.
Thank you, Madam Chair. You're thinking, just like I was, that we probably should break this down to a couple different 100-hour audits. I think that will get to your problem. You'll be able to get the information. And if we need to go farther, we'll be able, and I think you have the opportunity to go farther even than a couple 100 hours if needed. I want to go back. I really believe this last slot that we should do at least one of these 2 IT audits and make sure we get these IT audits. It's so important, the IT piece and what we're doing in this state. And we've come so far, but we were a long ways behind. And I don't know, to me, I think we should think at least doing one or figure out how to do both of them. So my recommendation would be.
Is it a substitute motion?
It's a substitute motion to do 2 100-hour audits, limited scope audits, and separate, is it number 4? Into 2 separate 100-hour audits.
Okay, we could separate those, and would it be okay with that substitute motion to, of course, include the fact that it's conceptual and then allow Chris to work with Representative Finney to see how that breaks down, to see if that's fully doable? Would that?
Oh, certain.
Okay, all right, so do we have a second on the substitute motion? Okay, Representative Gardner seconded that substitute motion. So now we're looking at potentially 2, in which Representative Finney will work with our staff to see if that fulfills the need that you're looking for. Are there any other discussion items for this one? Representative Toplicker.
Just a question on the motion and the questions. What do we expect to get out of an economic impact of this whole thing? I mean, these economic impact studies, they're pretty subjective, and they can be endless. And so I'm not sure what the ultimate objective is into getting some number, some dollar figure that you can attach to this. I mean, I just don't know where exactly this is going and how big this could be. I mean, you could, I just don't know what for sure the ultimate objective is. That's all I'm saying.
We could ask Chris to respond to that, but I would just add that she's going to redraft that with Representative Finney so they can scale that to something that it wouldn't be a full-blown, economic impact, but it would give a starting point, and it could at least define some costs that are being incurred on either the individual or a state. So, Chris, would you like to add anything to that? Okay, and Senator Olson.
And one of the reasons why I left that in there, I'll be honest with you, right now we're at a high employment status. And, knowing that these people can't drive, there is an economic impact to society because these people would be able to drive or get to a job in their labor force, which would then probably even make employment even higher. There'd be an impact of tax revenue, because there's jobs out there that are not being filled. And that's one reason why I left that piece in there. There is a impact. And, if we can figure out a way to, maybe other states or figure out a way to get these people back in the employment side, can relieve that, can get their life back on a normal track.
All right, any other comments on this action item? So with this motion, Justin, I do want to clarify, are we adding it to the consent calendar, or is this going to be approved? These will be approved, or do we need to bring language back to look at for the committee?
I think the committee can conceptually approve it today, and then we will work with Representative Finney, and we can run that by the committee, but barring any objections from the committee, then we could just move forward. That way we don't have to have another meeting in between when we would need to get that work started.
And I would just also encourage you, Representative, to reach out to the Judiciary Council. They might be able to do something or at least provide some additional information as you're working forward on this. So thank you for bringing this audit to us. All those in favor say aye. And those opposed, nay. Looks like that has passed for 2 limited scope, and please follow up with Chris to get some details on what we would have. Now, I said that I was going to come back to Representative Olson. We do have Representative Hubert first, but we will not leave without getting to your item, which I agree is important. So, Representative Hubert.
Thank you, Madam Chair. I know with the pandemic and education, is such a huge issue with the impacts that have happened. Your topic, 9L, was one that really caught my eye. And I do serve on education budget with Chairman Williams, and I do chair education. I'd like to make the motion with maybe a few tweaks on the questions asked. On the 4 weeks or more on remote learning, I know we have a lot of hybrid options with a lot of schools that are probably pretty much remote with a little bit of hybrid and in-person. And so conceptually, I would like to look at that first question as far as that 4 weeks or more, and then including the hybrids that are more leaning towards remote with a little bit of hybrid. But I think you could, in the scope of looking at those, break out and include the schools that are including a high concentration of hybrid, which is basically remote. And then on that second part, as far as the effects, you know, I think the effects are already pretty obvious, and I would love to kind of expand a little bit as far as some remedial types of, you know, what are schools doing? Can we find some lessons learned, or really try to help through the audit to promote best practices in how we're handling the effects? So that you know, I know I haven't really looked at the full scope, and I know Chairman Williams might be able to expand a little bit more on that, but I just conceptually was going to throw that out as a few tweaks to my motion as far as approving 9L.
Okay, I'll comment on that just a second. Senator Tyson? Did you want to second on it? Yes, a second. Okay, second has been made. Discussion. Thank you, Representative, for presenting that. And in light of Senator Olson's IT concern, I have reached out to the Department of Education. I would like to work with you, Representative, to fine tune that and maybe take a piece of that and bring it back for the committee to approve for a limited scope audit, just a piece of it, and then have the Department of Education. You know, I've asked Craig Newenswander to provide me some data. So in that way, we could preserve this audit and just move it aside, maybe do a piece of it. And I don't even know what piece would work right now. I have reached out to Chris and asked her, and right now it's pretty big. And so we would have to really reduce it, and then I'd have to lean on Department of Education to provide data, and I could do that. And so with that, I appreciate it, but I think if you're okay, would you withdraw it?
I can remove my motion because I appreciate
You're
maybe,
good. Okay.
you know, new
You're
to
good,
the
but
committee, I just wanted to.
I appreciate it. It is something that I'm very passionate about, and I do want to find out what's happening in Kansas. So, but I do want to open up for other options.
All right.
Senator Olson.
Yeah, Madam Chair, I think you could probably, if you recraft it a little bit, you could put pieces of your 9L and your 13E together. Because to me, they look like they're hitting the same entities, and they're both kind of focused in the IT area. So, I mean, maybe we take a pause, and when we meet next time, we just leave that one open, and then you kind of go to work and put the two together. And I think that might be a way to get yours done and this one.
Well,
Might expand it a little bit, but I think they're both in the same sector. I could be wrong. Let's Justin.
They're related, but I can talk to Chris later offline and Justin and see what we can do. And anyway, so with that, well, now you need to make a motion for the next item. So with that one's withdrawn. So now you, Senator Olson, have a motion for the next item.
Okay, my motion would be that we try to put 13, I'd like to do 13, and then to put pieces of 9L, allow you to work, I'm sorry, which one is?
I thought you wanted 12E.
Yeah, 12E, I'm sorry. No, okay, yeah, 12.
If you'd like, you don't have to do remote. We can just bring that back next time, and you guys would have, that way you would have an opportunity to look at it and approve it.
Okay.
That's fine. You can just do the one that you were kind of looking
Okay,
for.
good.
And if you want to combine the IT ones, you can, or you can revise.
Okay, yeah, we'll do that when we come back. So I'll go ahead and make a motion to approve 12E.
Okay, and a second by Representative Tyson. Okay. All right, further discussion, so Representative Burrows.
Thank you, Madam Chair. I thought my original point of bringing up 12E and 14E was to look at making 12E one of the audits that we looked at for the 100-hour audit or an expedited audit. So correct me if I'm wrong, Senator. I'm trying to help here and doing exactly what it is you want to get done.
Yeah, and I just fell off the wagon on that one because we did vote on that. So let's talk that through, Senator Olson.
The reason why I did that, and I just think both of these IT audits are very important. I think the most vulnerable place the state is, and it's IT. Even, I remember early on, our first university that we audited, all the exceptions, I've been in the executive meetings. I know which universities are really vulnerable. I'm taking both of these recommendations from my staff. I've sat on bank boards and I'm part of banks, and I know the vulnerability. I just went through the unemployment fraud, and I just want to see us make sure we're on top of our IT in the state. And I think by getting both of these audits, 12E and 13E, hopefully approved somewhere down the line, we're staying on top of it. I don't think we want to fall behind on this. This, really, in my mind, these are like the two top ones we should start with.
Okay, thank you, Senator. We'll come back to that, Representative Hubert.
I serve on JCIT, and I know that this topic with school districts and there are IT audits was something that we looked at the end of last year. And so we might reach out, and see kind of, so we're not duplicating. I know that there's already been some look at this issue. And again, that might be, I can guarantee you when we had the look, there was probably a need to expand to some degree, but I would suggest that even in part of how we do it would be a starting point with JCIT to review, compare notes, and make sure that we're.
That's a great suggestion. And Senator Tyson.
If the maker of the motion wouldn't mind, I'd like to add to the motion that we have the additional 12E, we do the audit on it, and then make the 100-hour motion the portion of 13E. And I think that JCIT, Legislative Post Audit, did those audits, so they're fully aware of the overlap between the two committees.
Thank you, Madam Chair. My thinking on 13E, I was just going to leave that one lay and let you work on that. And if you wanted to put some piece of it in your audit.
Well, I probably should have spoken up on that. I don't think they're the same thing. I think one's more on remote and how they're doing in terms of achievement, and one's more of how they're doing. But I think since Representative Burrows had a motion to do a 100-hour audit on 12, and if we make 12 the full audit, then we could take 13, a piece of 13, and do the motion that Representative Burrows did. Yes, so I think everybody wins, right? You still keep, yours is whole. Yours is whole, and I think that, is that?
I'm good with the plan.
Okay.
Actually, I would withdraw, I would withdraw the second and let Senator Olson make the motion, yes.
Restate your motion, please.
Okay. My motion will be to do the full audit on 12E, and then do you want that in a separate motion, though, or? Same. And a 100-hour audit on 13E. We'll downsize it and work with Justin and make that a 100-hour audit. So is that good enough?
I think so. The second was, were you the second? Okay, great. Good job, team. All right. Any further discussion on this item? Yes, Representative Burrows.
The motion is on 12E, we're going to do the recommended staff recommendation of 3 staff members, 4 months, the audit on that. And then the second piece of it is on 13E, we're going to downsize the scope a little bit and turn that into a 100-hour audit. So we will do a full-blown audit on 12E and then a downsized 100-hour audit on 12E, or 13E.
Representative Burrows, how's that? Is that clear? No? No? Well, we did. We flipped it, but you had, didn't you have 14E? You said 14E and 12E. So 14E stays as it is, as the limited scope. We just substituted 13E as the limited scope versus the 12E, and therefore your 12E motion became a full motion. So, and staff will send us maybe more than just a minutes, maybe just a list that we can all look at. Does that sound good? All right. Any other discussion on this? Yes, Representative Toplicker.
So what became of 9L?
9L, the remote
Representative
learning.
Hubert's. It's gone.
I went ahead and withdrew it because of the comments on IT, and I think we can get part of it. And so what happened was I'll get part of it from the Department of Education, and the other part I'll work with Chris to do a limited scope. And you don't have to approve the limited scope right now. I'll bring it back to you in June because I'm not sure how that's going to look. Yes, Justin. And I know we haven't taken a vote on this last item.
I was just going to remind committee, we do need 1L from the committee.
Yes, yes. So all those in favor?
Aye.
And those opposed? All right, the motion carries for the 12L. Yes, and the 13. So we're going to need a list of the new limited scope and the full. And I do want to apologize that I got us started off so late. So we have at least a good structure of how we're moving forward. We're not finished, but, and I don't know what the Senate's timetable is, but we have 5 minutes for the KBI audit. We have an executive session. I don't know what we're going to be able to get done. I do know that it's going to be hard to get back together. So you guys tell me what we need to do.
We go back in at 2, I believe.
Okay, so we have a little bit of time, and we're 1:30 for, but that's calendar, right? Okay, so Justin, is everybody okay with, yes, Senator Tyson?
Madam Chair, if I may, I know we've pushed the envelope on these limited scopes, but on 10L, I have actually heard from instructors in colleges that have grave concern over the remedial courses, and people are taking them 3 and 4 times, and that's taxpayer dollars that are being impacted by that. So if we could do a limited scope on that, I don't know if the committee would be receptive or not.
Senator, do you want to work with Chris on a limited scope audit on that?
Sure.
Okay, and I'd be happy to help as well, since it was my original, if you could send that out. And then would you be okay with us approving it in June?
Actually, I'd appreciate it if you drove, and I will.
Okay, I will do that.
Awesome.
Yes. So we don't have to vote on that right now. Representative Burrows?
Madam Chair, the appropriation meeting is having some tremendous discussions and votes while we're in this
I
room.
know, I know.
I just wanted to bring it to your attention.
Do they need us? Yes, that's Justin.
Madam Chair, the committee, of course, can direct us to do whatever it wants in turn. We could always reschedule this meeting if the rest of the contents. I do remind the committee, we do need you to approve 1S, which is that statutory scope. That was not considered as part of the ones that we had you.
Oh, yes.
So it's a mandatory. So if the committee would please make a motion so that we have that.
There's a motion, there's for, yes, second by Toplicker, so Representative Toplicker is the second, and Senator Olson's the first. Discussion, no discussion, all those in favor, aye, and opposed, no. So how bad would it be if we added this to our June meeting? The executive session items, or do we need to?
That's fine. Yes, I would like you all to hear those results. The good news is the agencies are already aware of those audit results, so that's the most important part. We do want the committee to know about that, but we can reschedule them since they are, since they, like us, are staff that work for all you. We will ask them to bear with us, and we will reschedule that when we set the next meeting sometime this summer with you, Madam Chair.
Okay, that would be great. Is that good with everyone? And again, apologies because this wouldn't have happened had I gotten my time right, but then appropriations. Okay, anything else that we need to do? Consent items or consent calendar items, Chris? Consent items. Approval of minutes, acceptance of a completed performance audits. All right, all those in, do I have a motion? I don't need a motion, do I? Nope. You're consenting, correct? Okay, all right. Thank you very much. We are adjourned. Thanks for the good meeting, and take note that you will getting emails soon.